So this is exercise number 9, which is ankle strategies. So you can see this better, I'll show you from the side as well. So ankle strategy is just, well, the ankle strategy itself is recovering your balance through movement at the ankle. But for this, we ask the patient to swivel back and forward, only trying to move at the ankle. So they'll pivot forward at the ankle, kind of feels like a ski jumper. And they'll pivot back at the ankle. As you pivot back, you should feel some heaviness in the heels, and the toes will lift up. I went a little too far that time, but you should feel the toes actually kind of pick up off the ground. And then as you swivel forward, you're distributing that weight forward, and you'll feel the heels lift up off the ground. Okay. This can be a helpful exercise, particularly for somebody that's coming out of an illness or injury or something that's affected the foot and the ankle. Could be a stroke, could just be an orthopedic condition, it could be just natural aging, but want to try to let them hone back into using the ankles to regain their balance. Let's talk a little bit about balance recovery strategies, and two of these, really all three of them, can be used as exercises. The first is ankle strategy. So just imagine that you are rigid from the ankle to the shoulders, just kind of a straight line from your ankle to your shoulder, but the ankle could still pivot. So as we pivot back, you'll feel the toes kind of lift up off the ground. As we pivot forward, almost like a ski jumper, you'll feel the heels lift up off the ground. Ankle strategies in use are real subtle or small movements, kind of like a tree blowing in the wind, but they're, again, like that same example, they're happening all the time. So using them as an exercise is just to let that patient feel that change in pressure forward and back, and to see, do they have the motion, do they have the strength to be able to make those corrections around that ankle. Now, if we progress that ankle strategy and go a little bit further, whoa, you can see a hip strategy. So many times it's helpful just to work in one direction with the patient. In this case, I'm working posteriorly. But notice what's happening. As I lose my balance backwards, I push my hips forwards, but I also raise my hands forward, or raise them up to redistribute my weight forward. Raising the hands also slows down the loss of balance, how quickly I'm losing my balance backwards, and it gives me a chance to make a recovery movement at the hips. So contrast that with going forward past the ankle strategy, and you see me kind of try to push my hips back at the same time I'm raising my hands up and back. The hand movement might not be natural at first for patients because they're going to want to reach out in front of them, but if I reach out in front, I actually send my loss of balance further forward, and I don't help myself out at all. So that's ankle strategies, that's hip strategies. And if ankle and hip strategies aren't enough to keep your balance, I keep going backwards, then we start to take some steps, and that's called a stepping strategy. So if I lose my balance forward and the hips can't quite get the job done, then I take a couple of steps and step it on out. But take the time to go through and train your patients. What are these balance strategies? How do they work? Turn them into exercises. Emphasize ankle strategy, hip strategy, and stepping strategy. The last strategy we didn't include in that, and I'll show you from the side because it's easier to see, but think if you're in a canoe, you do this. And that's just called a knee strategy. Unless we get on something unstable, let's say like a rocker board, we don't tend to see knee strategies as much. I think maybe escalators too, in addition to docks, floating docks and boats and things like that. So thanks for tuning in, and don't forget to strategize to help your patients understand these different strategies. Thank you.